Okay, guys, in this case, we are going to discuss a little bit about the anterior abdominal wall. The area of interest is the umbilicus. Okay, so this is using a curvilinear probe in the transverse axis. Okay, we are going to do a craniocaudal sweep. All right, now I've frozen this frame. Okay, to show you right now the I'll just scroll through so that I can delineate the structures for you. Okay, so if you see here, this is where the probe is placed, and then directly under the skin we have the subcutaneous fat, which appears hypoechoic with the interstitium and the fat showing these echogenic septae within it. Okay, and then abruptly we have on either side here the rectus abdominis musculature. Okay, the rectus abdominis muscle is connected in the midline by a dense fibrous tissue which appears bright and echogenic. This is the linea alba. Okay, and deep to it we enter the abdominal cavity where you have the abdominal fat, peritoneal mesentery, the visceral fat. Okay, so now I'm just going to scroll a bit to give you an idea. So this linea alba, which is seen in the midline, in fit individuals, it can be seen as a depression, while the rectus muscles on either side will appear as the six-pack muscles. Okay, so what are the layers that form the linea alba? The linea alba is formed by the aponeurosis of the three muscles of the anterior abdominal wall: the external oblique, the internal oblique, and the transversus abdominis. Okay, so it appears as a homogeneous, bright, echogenic structure, and any interruption in this would suggest that there is a hernia or a ventral abdominal wall defect. Now, as you can see, when I come to this point over here, you can see that there is a breach or a discontinuity in this bright echogenic line. And there appears to be a direct communication between the subcutaneous fat and the intra-abdominal fat. Okay, so this is how a ventral abdominal defect would appear on ultrasound. Okay, if you carefully look at the margins, you would actually be able to delineate the hernial sac. So if you see here, you can clearly see there is a distinct appearance of the fat that is herniated from the abdominal cavity into the subcutaneous plane. So this is the defect, and this entire thing out here is the hernial sac in the subcutaneous plane. The typical content that usually herniates in an umbilicus is the you can call it the peritoneal fat, mesenteric fat, omental fat, and this can at times get strangulated, limiting the movement of bowel within, and at times you can even have directly bowel herniating into the subcutaneous plane. Okay, now while we are discussing this, I also want to discuss the entity called divarication of recti or rectal diastasis. So these are the two rectus muscles. This is the left rectus and this is the right rectus, and this linea alba, when the distance between the two recti, the interrectal distance, that would be starting from here all the way till here. So let's look at this case right now. See, this is 25 mm. So okay, so closer to the xiphisternum and closer to the pubic symphysis, we are looking at a normal range of somewhere between 15 to 16 mm. Towards the umbilicus, it progressively increases from 15 to 20, 25 to 30 mm. But divarication of recti is more of a clinical diagnosis, where we can visibly see, if we ask the patient to raise the head in a supine position, you can see an abnormal bulge. But the difference between a diastasis of the recti and a hernia is that the linea alba would remain intact, thinned out but intact in a case of diastasis of the recti. But in the case of an umbilical hernia or a ventral abdominal hernia, there will be a clearly demonstrable breach in the linear album. Okay, as you can see here, where there's interruption of the hyperechoic line.